Hello, my name is Dr. Brian Reed, and I'm a naturopathic doctor. And this is a video about some of the persistence mechanisms that can be employed by Borrelia burgdorferi, the bacteria that is the causal agent of Lyme disease and also potentially persistent borreliosis, or sometimes known as chronic Lyme disease. So anyone who is directly or indirectly afflicted or affected by persistent borreliosis knows that it can be a real bear to get on top of. It can affect so many systems in the body, cause really debilitating symptoms, and be really hard to kick to the curb sometimes. There are lots of strategies that we can use, going after the microbes using, different substances, different herbs, things like that will go after the microbe in a multitude of different ways using different mechanisms, immunomodulating, help the immune system get back on track to kick the microbes to the curb. We can use biofilm disrupting agents to try to get rid of the hiding places of the microbes. We can use different agents that target round body forms, which is kind of like the stationary or dormant form or phase of the Borrelia. So sort of like its hibernation mode, or form, so to speak. So we have lots of therapies that we can use to try to get over past some of these defense mechanisms. But I think just being aware of the many defense mechanisms or persistence mechanisms that Borrelia has is just sort of I think useful to know about, and maybe helps to shine a little bit more light on why this microbe can be so hard to get a handle on. So I mentioned a couple of those persistent mechanisms already. They can go into that stationary, more of like a hibernation form in terms of a round body form. Round body forms are sometimes referred to as cell wall deficient forms or cystic forms or L forms. None of those really describe them that well because they're not cysts, they're not cell wall deficient. And then L form, L stands for Lister because they were discovered at the Lister Institute, so they don't have an L shape or anything like that. The round body form seems to be the most scientifically correct term to use, to my understanding at least. And so they can go into that dormant sort of hibernation form. They can also form these biofilms as well, so these proteinaceous polysaccharide compounds that can form on our inner lining of our blood vessels and our sinuses and other parts of the body, and can really act as like a hiding place for those microbes. In addition to that, they do a lot of gene transfer, so they will ultimately change up their genome to help to detect or to escape rather immune system detection or identification. So it's kind of like it's this moving target for the immune system, which can be why they can persist so easily. There are other strategies that they employ as well, which just make it really, really hard for the immune system to mount a fulminant response to just totally kick it to the curb. They can change up their surface antigens, things like that. Like it's very, very tricky for them to get eradicated by the immune system. So these persistent mechanisms are really quite effective. So I wanted to mention that and just to shine some light on some of the reasons why it can be so difficult. But as I did mention earlier, there are lots of different therapies, maybe not lots, but there are a number of different therapies out there that can help to circumvent those defense mechanisms. So the way I kind of think about it is that these microbes, these bacteria, these little single-celled organisms are very, very, very smart. But I do like to think that we are still smarter as human beings, at least some of us, and we can work with tools that help to get around those defense mechanisms. So, working with a clinician who's aware of those types of defense mechanisms and how to get around them is really, really important. Also, making sure that you're working with a clinician who is aware or is able to determine, when those persistent borreliosis symptoms, like those chronic Lyme symptoms, are maybe no longer related to Lyme, or they're maybe were partially related to Borrelia, but there's something else going on. So I've had patients where we're working with the antimicrobial herbs, and then they get to a certain point, but hit a plateau, and then we get the round body form targeting herbs in there and kind of hit a plateau, and then we get the biofilm disrupting agents in there and further improvement, and then hit a plateau. And then the question mark is like, well, do we need to just keep hammering away at this, or are you plateaued because we've gotten rid of most of the Borrelia, but maybe there's other things going on, whether it's related to mold illness or SIBO or methylation issues, or just that their mitochondria are really depleted, and so they're feeling, that ongoing fatigue or brain fog because of that, not necessarily due to an ongoing microbial infection. So it is always important to kind of keep that in mind too, that if you're hammering away at Borrelia because they have so many of these defense mechanisms, at a certain point, if clinically you've kind of done everything and you've hit a plateau, that would be a time to think, well, maybe there's something else going on at the same time. And in my practice, at least, oftentimes there is at least a few things going on at once, not usually just Borrelia on its own. So those are some thoughts about Borrelia and persistence mechanisms, and I hope that's of interest and use to you.